Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Today's topic, we're going to be talking about female reproductive system. We're going to give you some, heads up. We're going to give you some tips. We're going to give you some things that you mostly ask about and you have no answer. So we're going to summarize this next 40 minutes or so, talking about this only. So please, if we can play the first video, so we can comment on it, please.
Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually, it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse, and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
So that was a good introduction on how things happen. As you see, the male has not much role to play in this except for the sperms. So let me go over the male issues that we can commonly find that concern with infertility. The male gives the sperms. Once the sperm is ejaculated into the vagina, the sperms knows what to do. You see, the sperms goes from the vagina through the cervix to the uterus to the fallopian tubes, and then once the egg is kicked out of the ovary, they go to the fimbria, a place between the tube and the ovary, and fertilization happens there, and then the journey continue back all the way to the uterus, where the zygote implants. That takes about, in day 7, 5 to 7, the implantation take place. And once the implantation take place, the function of this zygote now is to dig in. They're looking for food. They dig in into the wall of the uterus looking for food. And their food is actually the blood supply. So once to get into the blood supply, a hormone called beta HCG is secreted into the blood about day 9. And this is when you can test for positive pregnancy test. That's how it happens, and this is how the journey happens. Now, let's talk about infertility. The man has a very small role to do. The man gives the sperms. The sperms know what to do, and they do the job. So the man can have a problem with the sperms, either with number. The number is not there. You heard in the video, we need 300 million, about 300 million. 150 million will do. 150 million. So either the count is low, or either the functionality is not there. The performance of the sperm is not there. The sperm is deformed. When we're talking about numbers are not there, we refer that to infectious causes. Most of the time, the area, the environment where the sperm is made is not suitable for the right production of the total amount. They get killed because of the bacteria, because of other things that has changed the pH, which is the environment where the sperms lives. Another condition that can affect the sperms is the variceals, is the dilated veins. We're not going to talk much about medical terminology, so we'll make it simple. When the veins in the testicles are dilated, that dissipate more heat See, when God made the testicles in the scrotum outside the body, it was for a reason. Why? Because we do not get the sperms exposed to normal body temperature. So it has been made to sit in a scrotum outside the body, which is about 1 degree less than the body temperature. So if you have dilated vein in the scrotum, that will dissipate more heat, that will not be favorable for the development and the full growth of the sperms. So that's why we can have a decreased number and or decreased functionality. So we mentioned 2 things. Infection can affect the number and functionality as well. Extra heat coming from extra dilated veins in the testicles can also affect the number and functionality of the sperms. I got a patient about a week or 2 ago. He has been diagnosed, he done the spermogram. We do something called a spermogram, where we can tell you the number and the function of your sperms. So this guy has a spermogram that shows 0 sperms. So somebody recommended him that he goes to such and such village and get those herbal things, that concussion that they made. They spend in hundreds of thousands. And after almost 1 year, he comes back and he said, do me a spermogram. We do the spermogram, still 0. We do the ultrasound, we do the physical examination. The testicles are very small, very small. So this guy, unfortunately, had what is called primary hypogonadism, meaning there is no way you can have sperms. No way you can have sperms because you're not making them. There is no testicle tissue to make the sperms. So do not waste your time and money, because that's where it is. You don't have the factory that makes the sperms. So this is the extreme. Other causes, whether it's dilated veins or infectious causes, that can easily be dealt with. If the numbers are low and we need to stimulate the production of the sperms, there are injections. And let me talk about those herbal treatment. And it's very sad. I seen during my practice years, young girls, let me just say something. Please do not call me, because I will not be able to take calls. Just, the number is there on WhatsApp. I want you to just send a message on WhatsApp. So if you're taking some herbs or something from somebody who is making, with all my respect to everybody out there, I'm just giving advice. I seen patients, young girls, young boys going to dialysis because of things they take. They put in their mouth and they don't know what it is. If you want to take a herb, know the source, where is it coming from, what its name, and investigate, is it good or bad. Most of our medication today is coming from herbs, I agree. But we know the dosage, we know the effect, we know the side effect, we know when it's harmful, you understand? We know which one causes failure in the liver or failure of the kidneys. We know which one is toxic to the brain. We know, we studied them. That's why they have pharmaceutical companies making medication, because we know. But when you get me something from the forest and tell me take this because you're gonna get pregnant, come on now. Or you're gonna, that's something. You know, if you do not, and the way he prepare or she prepare this concussion or that you take in with your mouth, do you know how sterile it is? Did you know if it's fermented or not? Do you know it has bacteria, deadly bacteria or not? You don't know. So please do not put anything in your mouth unless you're sure of the source. Okay? Unless you're sure of the source. That's all.